Hi, good afternoon, everybody. I'm Sally Shaw. I'm a senior advisor with Partners in Care and Health, and I lead on the Working with People workstream. I would like to hand over to Lyn Romeo for an introduction into today's webinar. Thank you, Lyn.
Great. Well, thanks everybody for joining us. I'm really keen on how can we make the best use of digital technology to really ensure we give access in a speedy and timely way to all those people and family carers who are supporting people so that they can get a good response in a timely fashion and in a way that really suits them. So obviously we're always balancing that with inclusivity and making sure people don't get excluded. So it's a nuanced approach, but lots of opportunity here to think about how we can become part of the technical revolution that everybody's involved in. So in August, we published the Proportional Assessment Guide. So I'm really pleased today that what we're going to look at is something very practical, which is around a toolkit, a good practice guide to really help you think about how you can make progress on utilizing different ways of having online self-assessments, of using technology in different ways, of using triaging tools and so on and so forth. We're looking at ways that we can really support you in this. And in particular, this is all about progressing our work around reform and the next steps to put people at the heart of care. And you will have had the grant to streamline local authority adult social care assessments as well. So it's thinking about how you can utilize that to really take forward potential in this area. So the most important thing, of course, is always putting people at the heart of things, involving people who call on care and support or who want or need care and support, their family carers, other professionals, to co-design and co-produce any digital approaches that you will take to really make your service very accessible, very responsive, very intuitive to what it is people need. Now, I'm sure all of you in your day-to-day lives use different ways of logging information, of asking for information, of putting forward your own details so that you can get sorts of things you want. So too it is in our social care world. We just need to make sure it's absolutely nuanced and right in terms of supporting the people that we are here to serve. So I haven't got much more to say about it than that. It'll be a really interesting session and great toolkit. I've had a quick look through it. So I'm going to hand over to Lindsay.
Hi, everyone. So my name's Lindsay Craik. I'm Deputy Director in the Department of Health and Social Care, and I'm responsible for charging, commissioning and markets policy. So it's my team and I that have been working closely with Lyn on this work. Firstly, we're just really glad to see so many local authorities here today to support this shared learning. It's ticking up all the time. I think we have 182 people on the call now, which is fantastic. And I wanted to particularly just say a thank you before we get started to all the local authorities who have fed into this toolkit, and to Kent County Council, who are here today to talk a bit about their experience of digitising services. It's going to be really great to hear from you. Just as a bit of context, in addition to what Lyn has said, I thought it would be helpful to just say a quick word on where this guide fits in relation to our wider work programme. So as many of you will know, the streamlining and digitising assessment work came out of preparation for charging reform, where local authorities had been making significant progress in transforming their assessment processes ready for that increased demand. And in the Department of Health and Social Care, we then decided to put in place a programme of work to capitalise on all the really fantastic things that local authorities were already doing and to see what more we could do to support you with this process. So just to mention that we've done or are doing, in addition to what Lyn's mentioned. So we released that 27 million of funding back in March to support work to streamline assessments, and we're evaluating that at the moment to understand how it's being spent out there on the front line. We're also doing a really interesting piece of work with HMRC to pilot greater data sharing between local authorities and central government to support financial assessment processes. We're working with the Department of Education as well on what we can do to improve case management systems, and we're developing a toolkit to support local authorities in streamlining their end-to-end operating models. So the guide you'll hear about today is kind of one part of a wider work programme and a wider suite of products, which we will be talking to you more about in due course. So yeah, so purpose of the guide today, we wanted to share all the great things local authorities are doing, so other local authorities can apply best practice in a way that works best for them, because of course everybody will be starting from a different point, have different challenges and opportunities in their area, but hopefully this is a really helpful place to bring that together and start a good conversation. So I'm handing over now to Caroline Gloyn, who heads up our team here in the department, and she's going to talk you through the guide in more detail. Thanks, Caroline.
Brilliant. Thanks so much, Lindsay. So I think that's been a really helpful overview of sort of all of the programme of work that sort of sits in this, and I think we're really open to sort of how we best work together on sort of future iterations. And I know there'll be a bit of a plug, there'll be a survey coming around after this, which will ask feedback on this, but also sort of what topics you'd like to explore next, because we think it's a really good way of sort of getting people together. But as Lindsay said, we're sort of specifically here to talk about the online needs self-assessment, and specifically a guide that we've recently published, which we will make sure you all have the link for. We've been working with local authorities and a delivery partner, Mason's Advisory, to produce that good practice guide, and it draws on insights and learnings from local authorities who have already implemented the tools. It's designed really with a sort of practical implementation mindset, so to support change managers in thinking through sort of all of the steps and considerations when implementing these tools. We've also been working with people with lived experience to ensure that the guide works for the people who will actually be using them. And as that slide sort of sets out here, we obviously encourage you to think about that co-production locally. And then we're thrilled that Kent are here specifically to share their experience. So I will be handing over to Renu after we just do a little bit of an introduction to the guide. So if we could move on to the next slide, and I will just say these are the very high level bits of the guide. The guide goes into a lot more detail, but in such a way that probably wouldn't be engaging for a webinar. So we've just drawn out some of the insights. So one of the things that we started off looking at is sort of what is the case for change for supporting this work. And I'm sure none of this will come as a surprise for you, and the guide goes into much more detail. But as Lindsay mentioned, we saw really good examples of local authorities reviewing their operating models and opportunities to digitise under the charging reform programme. And there are some really clear other drivers for change. So I've just put a few on the slide here, including sort of known capacity gaps in the workforce, supporting friends and families to access support for people who need care, and how to better meet the needs and outcomes for people drawing on care, which crucially sort of frees up social worker and occupational therapist time to spend more time with people with more complex needs, having the sort of more quality conversations. The guide goes into much more detail around these, and it's sort of designed to help you think about how to make the case internally for implementing these tools. But as I said, I'm sure these are all very familiar to you. So if we move on, I'll just outline sort of what's in the guide, and some of you may have already seen it. But the guide, which we've sort of tested heavily with the sector, goes through each stage of planning and implementation set out on this slide. So hopefully we, as I say, it's got a real sort of implementation focus, and we hope it will be sort of helpful in terms of making sure that you learn from other local authorities who sort of perhaps wish they had these toolkits when they were starting out on their digitisation process. It also explores the different types of assessment. As we know, it's really not a sort of one size fits all approach, and it will really vary sort of depending on local challenges, approaches, but also sort of the starting point and your sort of internal processes as to the extent to which you can sort of automate or triage. We just thought it would be helpful to sort of quickly outline those three different types of assessment, given we know you might be thinking that you're sort of focused on one more than the other. And these, again, are sort of more thoroughly explained in the guide. So if we can move to the next slide, please. The sort of three classifications of tools that we've outlined in the guide vary in terms of the level of information capture required and the level of sort of automation in terms of next steps and solutions provided to the person seeking support. We've categorised this first one as sort of an alternative front door in place of phone or email. Clearly, this sort of has benefits as you specify the information you are asking for as the local authority, and you provide a sort of degree of standardisation in terms of the responses and the information you get back, where you might not get that via email and phone when people are trying to contact the local authority. And depending on what sort of how your internal process is set up, you can ask for more or less information to be able to direct individuals to support and make sure it reaches the right place. These are probably also the sort of lowest cost, most easy to implement, and they're also probably the most easy for the person submitting the application to use, and are a sort of a convenient way to input data. These are possibly the most appropriate for certain demographics as well, but I guess in some ways, which the guide explores in more detail, they don't go as far as some of the other tools in terms of reducing burden or demand on local authorities, as you get all that information in a more standardised way, but then you still need to do something with that information, where some more burdensome tools will do some of that for you. So if we go on to the next slide, the next sort of tool we talk about in the guide, and the things you should consider around it, is triaging, so directing the individuals to the right information and team, and sort of to help manage waiting lists and make sure that most urgent cases are getting support first. Again, this has degrees of automation ranging from sort of manual triaging, or developing the tool to the point that it automatically sends the person to the right team or directs them to the right support automatically. These can be really beneficial, as I say, in terms of getting people to the right support quicker and supporting effective prioritisation. And the guide has some specific tips around how to maximise this type of tool, including having the right sort of data cleanse tools in place and options for further automation. And then the final tool we sort of explore, and yeah, even as I say, there's sort of, it's almost a 3x3 grid, because there's variations in each of the tools. But on the next slide, we have the final sort of type of classification that we've used, which is around full self-service. So if we could just move on to the next slide, please. There we go. And this can sort of point the individual towards the right information in terms of a sort of full package of support, and pointing them towards advice or guidance, and creating a journey based on sort of what the individual has already tried. This can also serve as a record for the individual, of the individual's needs, to be able to discuss with the social worker, and making sure that sort of we have that all of that information forms part of the right care and support package. Clearly, there are some instances where people have urgent or complex care needs that this doesn't work, but this is sort of the most effective tool, we think, in terms of empowering people to access support based on sort of existing tools, or pointing them towards existing things that they might be able to buy or try to support themselves, to sort of enable their care journey independently. So in addition to sort of these three types, if we just move on to the next slide, and going through the detail of the sort of process for each of them, the Good Practice Guide also explores the things set out here. So advice on user-centric design based on the local authorities we worked with, example assessment styles and the types of language that works well, and that people that we sort of interviewed responded well to, user personas, and really understanding how to sort of tailor the tool to the users, and a local authority case study. And as I say, we're delighted to be able to hand over to Kent shortly to be able to go through that in a bit more detail. It's now available, I think, or it's definitely available on Sky's website, and it will be available very shortly on Partners in Care and Health website, and we will circulate the link. We really, as I say, we've tested it quite widely, and we think it should be a really, really helpful tool. But we're open to sort of feedback on how we can iterate and make it a continual sort of learning process. So we really do welcome that feedback. And then, yes, as I say, we thought it would be sort of most helpful to hear from actually someone who's done it, and someone who's done it very well. So we're very grateful for Kent coming along today, and I will hand over to Renu now.
Good afternoon, everybody, and thank you, Caroline. I'm Renu Purvis, the project manager in the Innovation Delivery team here at Adult Social Care at Kent County Council. So today, the digital self-serve solution, obviously, that we're going to talk about is the self-assessment that we have implemented in Kent. So in terms of working together and staying connected, we worked with a company called Looking Local that have developed Better Care Support, which is the online self-assessment. Now, when this was initially developed by Looking Local, they worked with 6 of the local authorities, and also each local authority had experts by experience as part of their core membership for the development. So our focus really is about working together and how we do that, so that we do meet people's needs, and that we can deliver our Care Act duties as well, of providing good information, advice and guidance, and also preventing, reducing and or delaying people coming into adult social care. This also very much aligns to our principles, which is the making a difference every day, of practice, innovation and meaningful measures to improve and streamline digital processes, ensuring people are in control of how they engage with us, making it fit for the future generations and also promoting that channel shift. So a lot of work has gone into this in terms of providing that accessible information. It's 24/7 and it's timely, it's clear, it's transparent and it's meaningful. The navigation is absolute key so that people aren't clicking on a number of different clicks to get to the information they want. And it's about having the right information at the right time. And like Lyn has said, we do keep the person at the heart of everything that we do. And the way we do that is we listen to the people that we serve. In terms of co-production, we collaborate with our partners and key stakeholders and organisations as well. So in terms of how we went about the development of the self-assessment was we developed a very simple task and finish group, and in terms of the membership, it was very important for us to make sure that we had membership from the business, so adult social care representation from OTs, social workers, and also managers as well. We felt that in terms of the membership, we also needed to have experts by experience, and we were fortunate enough to have both cared for and carer membership at our task and finish group. And obviously, to make up the membership, we also had looking local in terms of how we were going to do that development, and the project governance, I guess, goes without saying in terms of putting that in place. So in terms of systems and processes, what we decided to do in Kent was, given the population and the scale of, the services that we provide in terms of the numbers that we serve, we felt that it was probably best for us to pilot the self-assessment in one locality area. There's 4 locality areas in total, and there's about 24 teams, community teams. So just from that, you can see it's big. So we decided that we were going to pilot this in the West Kent locality, and we did that from around about the 22nd of May right through till the end of September this year. So not for very long, but we tested the solution there. What that meant was that we could further develop the solution working with Looking Local. So there was further development that we were able to do as part of our pilot, which was then rolled out to other local authorities that also use the Better Care Support solution. The great thing about the Better Care solution is that each domain is supported by animation, followed by a number of questions, and there's also free text fields within it so that people, if they want to, can give us more information. There are 10 Care Act domains within the assessment, and people don't have to complete the whole assessment in one full swoop. They can complete a little bit, save it and go back to it. And the other great thing about the assessment is that people only complete the domains that are relevant to them. So there is no expectation that they have to complete the whole of the assessment. It's only what they feel is relevant to them. What that does is it gives the person a tailored summary of self-help options. So what they can do at that point is look at those self-help options against each domain that they have completed to see if that is sufficient. If they feel that they've got what they wanted, that's the end of the assessment. They go away and source that themselves. If, however, they feel they need more information from us, they can submit their self-assessment to adult social care. And what we do is we don't have it integrated automatically into Mosaic, which is our electronic client record. We actually have within each locality a triage service, which is called the area referral service, which is made up of social work staff and other officers. So once we receive that referral, we will create the contact in Mosaic as a manual process, because what we didn't want to do was to create bottlenecks within the service with every submission going in by automatic integration. What our area referral service then do is they will do a triage. So they can see straight away that person's demographics in terms of their name, their address, date of birth, their location. If the assessment is completed by somebody else on their behalf, we know who that person is because we've asked for their details and also consent as well. And now when we get that assessment, we can see straight away the tailored self-help options that person's already been provided with, which is absolutely great because we're not having to have that repeated conversation with the person having to tell their story over again and duplicating. And at that point, we can either provide further information, advice and guidance and close the contact because that's all they need. Or actually we put them through the workflow within the Mosaic system because we feel working with that person, they do benefit, they'll benefit from a care needs assessment. We've done lots of work around communications. We're constantly doing digital roadshows where we're out in the community promoting not just the self-assessment, but other online solutions and tools that we have developed here in Kent. So it's absolutely key that we keep that message going. We haven't done a full marketing campaign yet. That's something that we are working on, but we have used the organic channels of sharing and promoting the self-assessment, you know, through social media, for example. We've done a lot of training with not just our staff at KCC, but also with our partners and health colleagues as well. And we're also helping health colleagues now, looking at their digital front door offer for their patients, which may work hand in hand with what we've already developed. Next slide, please. So in terms of KPIs and reporting, obviously we have a contact centre, which is a corporate contact centre. So it's not just dedicated to adult social care. They're a very busy contact centre, and what we want to do is to reduce the number of inappropriate referrals that go to the contact centre by having the self-assessment. We also want to reduce the number of referrals going into localities, and this is where the self-assessment is absolutely key, because when we do get that submission and we triage it, we are now finding that the only ones that are going through for a full care needs assessment are the ones where we feel that's the right approach for them when we work with them. We use the data that we get from the Looking Local solution. There's a whole admin console that sits behind the Better Care support that we can see people that are accessing the self-assessment and what domains they've completed, if they've got the information they wanted or whether they've submitted. We've also produced, well, we're in the throes of producing our own Power BI reports from Mosaic as well, from the ones that go forward. Customer feedback is absolutely key. So we do ask for customer feedback on the self-assessment itself through the website, and also people are able to put that into the self-assessment as well. One of the things that we did an internal audit to check that we met the accessibility legal standards, and we're pleased to say that we met all the legal standards and it came out as a very low risk, which was great for us. And the whole ethos of this self-assessment is to provide people with those self-help options so they don't have to contact adult social care. There is a short video on this slide, so when it's shared, you'll be able to see the animation in one of the domains, but right at the beginning of the presentation, there is also the web link to our solution. Next slide, please. So this data here was collected purely for the pilot. So we went live across the county as of the 2nd of October this year. So we've just recently rolled it out across the other 3 localities. But during the pilot period, we can see the number of users that we had and the total number of referrals that were submitted. On average, it was taking about 12 minutes to complete. Now, that will vary depending on how many domains a person is completing. And we found that only 20% of those needed further help. you know, and a lot of the ones that were submitted to us was around aids and equipment around the home that we were able to support them with further information, advice and guidance. So this is just during that pilot and these numbers here, but obviously now that we've rolled it out across the county, we will be putting in some more meaningful measures in terms of measuring this as we move forward. Thank you. On here, we've just got some case studies in terms of, you know, what people have said in terms of their feedback. But feedback, just before I talk about these, feedback from our task and finish group, in terms of social workers, they have said that they really like the way that the Better Care Support assessment is set out, aligning to the 10 Care Act domains. The OTs like the animation around, you know, aids and equipment around the home and how people can help themselves. And what our experts by experience that said from the task and finish group is that they like the fact that, you know, the navigation is good, the language is good, the format's good, and it is seamless in terms of how a person completes it. On this slide, you can see there's 3 examples of where the self-assessment was used. I won't read them in any detail, but overall, the feedback that we are getting is that it is a useful tool. People are using it, and it's great to see that now our partner organisations and health colleagues are also referring to the self-assessment when they're in touch with somebody that's looking for support. Thank you. So obviously, we talked about Mason Advisory. So we were one of the local authorities that also worked with Mason Advisory in terms of helping produce that good practice guide, which we're all going to see. So this slide was just basically saying that, you know, we were part of that. We were very proud to be part of that. And in terms of what we've developed here, we are now getting contacts from other local authorities saying, hey, can you help us? You know, we like what you've done, and we'd like to do the same. So that's great. And I think that's the end of my presentation. Yes, thank you very much for your time, and I'm sure there'll be plenty of questions, from colleagues.
Thanks, Renu. So I'm just picking up some of the questions from the chat, and there's a couple that are themed around, accessibility. So, the challenge for those people who maybe their first language isn't English, and how's that been addressed? And also, maybe about how can we make this accessible to people regardless of their digital sort of ability?
Okay, thank you. So, and I think, Lynn and Caroline also referred to this, we do recognise that one size does not fit all. So, having a digital solution in terms of self-assessment is just another way that people can make contact with us. We've been very clear in our communication to say to people, look, we're not taking away any of those traditional routes that you may want to contact us by ringing in or visiting a community team or visiting a hub somewhere. Those absolutely stay in place. This is more about that digital transformation and where we're going with that, for future generations and that channel shift and future proofing. In terms of other languages, we do have an interpreting service within KCC that we can access, so we would use that.
Okay, thank you. There was a question around what proportion of users in the Kent trial went on to request further support from adult social care?
So it was about 20% from that 1,500, I think, that accessed the self-assessment, and only, I think it was about 580 that submitted. So it was about 20% of that needed further information, advice and support or a needs assessment. So we were able to filter that out, in the triage service. And we feel that that is the best approach for us because, being a big local authority and the numbers that we deal with and the increase in demand that we are seeing, we felt that, we wanted to do that triage right at the front door so that, we deal with those submissions appropriately.
Thanks, Renu. And there seems to be a couple of colleagues who are looking to try and put a business case together in that kind of, return of investment. And there's just a question there around, have Kent been able to quantify savings from using this tool?
It's difficult to say at the moment because obviously we've just done the pilot and now we've rolled it out from the 2nd of October this year across the county. But some of the savings that we certainly will be looking at and measuring is around cost avoidance. So, the numbers of people that we are supporting with further information, advice and support, and those that don't actually submit their assessment to us, but we can see they've accessed it and they've used it and they've got those tailored self-help options that they needed. So we will be looking at the cost avoidance of the solution, and how that's helping us.
Thank you. And I know you did touch on this, Renu, but a question around, obviously, you've really talked about the system being clear and transparent, but a question around, is it consistent and compliant with relevant legislation? I know you did touch on that, you'd audited that. Is there anything else you'd want to make a response into that question?
I think, I don't think so. Obviously, we did meet the accessibility legal standards. We've tested this out with experts by experience in terms of navigation, the format, the layout, and the language. We undertook our own internal audit as well around accessibility. We're well covered.
Excellent. I think we've got quite a bit of time, so I'm going to actually invite a few people in to ask their own questions. So, Josie Hill, I think you've got a question around, is it shortening the client's journey? Would you like to come in and ask that question?
Things that I'm from Derbyshire County Council and we've implemented something. It's very, very fresh. So only this month have been starting to get referrals through this route. One of the things we're really mindful of is making sure that when we think about the flow through, that we're not just adding another layer in, that the self-assessment isn't just something else that happens to the person before they get all the other offers that they would have normally had, if that makes sense. And so I'm just interested to understand a bit about how you've structured that in your services to make sure that the receiving teams maybe aren't repeating questions or they're having that seamless journey. Because I think you're in a similar position to us where it's not automatically being entered in as data into Mosaic. We're in that same position too.
Thank you, Josie. Yeah, I think, for us, it is really important that, that the person does tell their story once. So one of the things with the Better Care support solution was that when the person completed the self-assessment, they got the self-help options at the end of it. And what we wanted was, no, as a person completes a domain, they get the self-help options for that domain at that time. So that's a real benefit. The fact that it aligns to the 10 Care Act domains is a huge benefit, in terms of when we come to do that triage. And when the submission does come into us, we can see straight away that the self-help options that person has been given against each domain that they have completed, so that, we're not having that duplicate conversation or, asking the person to repeat their story again. So that, I think that's absolutely key. And as we know, communication is so important, and over I don't know how many decades, where people have said, clients have said to us, oh, you've passed me from pillar to post, I've already told this person my story, now you're passing me to somebody else. And I think also during the pilot, we didn't do any kind of full marketing campaign for it. It was just through the webinars, that the training I delivered in-house and externally, and also working with colleagues outside of the organisation. It was just word of mouth how this got out for people in the West Kent locality area. So yeah, we were really shocked in terms of the numbers for that very short pilot that we had. But yeah, I think in terms of integration, that wasn't a deal breaker for us, purely because We want to be able to do that triage. We want to be able to have that conversation with somebody right at the front door to see if we can help them with further information, advice and support.
Thanks for your
Thank you.
question, Josie. Shangle, I think you've got a question around safeguarding. Would you like to come in and ask that?
Hi, I'm Shangle Khan. I'm one of the heads of services for the London Borough of Redbridge. Yes, I'd just like to know whether your front door sort of encompasses all the safeguarding referrals as well as care assessments, or whether there's a separate route for identifying safeguarding referrals.
There's a separate route for safeguarding referrals.
And what does that involve? Is that online, or is that a phone, or a combination of everything?
It's a combination of everything, but we do offer an online safeguarding referral as well. Yeah, and we also offer a professional referral as well. But the hope is with the professional referral and the self referral that we've got, you know, in the longer term has, you know, we've now gone live with the self-assessment. So in the longer term, that professional referral and that self-referral we will no longer use, because we want, you know, our partners and key stakeholders to be citing people to the self-assessment by either, you know, helping that person complete it, or, you know, if they're able to complete it themselves, or somebody within their social network with support or advocates. So yeah, thank you.
Thank you.
Thanks for that. Adam Lacey, I think you've got a question around the fact that we actually call it a self-assessment, and this might be a question that one of the other panel members want to pick up. Do you want to come in, Adam?
Afternoon, everyone. Thank you for that, Sally. Yeah, it's one of those things where at Leicester City Council we've got something called a needs analysis form, and it might just be semantics, but I've heard rumblings that we can't call it a self-referral because under the Care Act we provide, or self-assessment rather, because we provide an assessment. It's one assessment. Is that true? Is that just a vicious rumor? I'm eager to know a bit more about that, because needs analysis is an awful name for a form, and I want to redesign it really.
Oh, that's one for Lynn, I'm sure.
Well, I don't know. I mean, it might be interesting. Obviously, it's worth looking at the client level data requirements now, and the whole when is a referral, when is an assessment, and so on. But I guess we want practice to drive what we do. And the reality is that an assessment doesn't just happen as a one-off. It's an ongoing iterative process. When does it start? When does it finish? This will be forever contested. It has been ever since I've been in social work, and I'm sure it won't finish once I've left. So I think if there are, through these processes, clarifications that we need to take back to our data people here, then we need to do that. This is never going to be perfect one-off. We're going to be continually learning and adjusting and improving, as with everything. So I think we don't want to get trapped in these kind of definitions of when is an assessment, when is it finished, and I know it's hard because of the CLDS work, but you know, as an assessment starts when somebody starts talking to you, however they start talking to you, whether it's giving you some information, getting in touch, and then at the point at which we're starting to say, well, we've got enough information now, and we've agreed you've got these eligible needs, and we're going to provide this support now. But then that might change, you know, as you move on from that point. But I know it can be very frustrating because we're trying to do two things, aren't we? Deal with all the kind of measuring, processing side of things, as well as make it very user focused and a conversation, whether it's online, through provision of information, through a telephone call, through seeing somebody face to face in their own home. But the points we need to take back from you, then we can talk to our CLD colleagues, client level data colleagues. But Caroline or Lindsay may want to come in there. You might have something more to add.
Well, no, I mean, completely agree with everything you've just said, and obviously defer to your expertise. And I think the only thing I was just going to add is, first of all, completely agree with your point around if there are things we need to sort of take away around language to make things easier, we definitely can do that. But secondly, I think there is some work being done via ADAS regions to sort of get consensus around the sort of types of language and then how that feeds into CLD. So definitely encourage you to sort of feedback through that if there are things that are acting as a barrier, because as Lynn says, we definitely want to sort of support you to overcome those.
Thanks, Lynn. Thanks, Caroline. Diane Williams, I think you have a question about engagement with providers. Would you like to come in?
Hi, yeah, good afternoon. Just want to say hello, Sally. Not seen you for a long
hi,
time.
Yeah. I wonder whether it's the same.
It is. Just my question really was, I suppose I should introduce myself. So I'm Diane Williams. I'm Head of Standards for the Master Franchise of Home Instead in the UK. So my question really was about how local authorities or Kent in particular, how you're engaging with providers in the area who may be supporting people who are not known to services because they're self-funding. So for instance, the Home Instead model starts with companionship-based relationship-led care, that at that point people might not have eligible needs, but people's needs change. So my question really was about how a local authority is engaging with those providers that actually could facilitate or help people complete the self-assessments online, but they would need some understanding about that, and probably it would be a useful point of engagement. So that was my question.
Yeah, thank you, Diane. So in Kent, we have a registered providers network. So we constantly we do a monthly newsletter, so it goes in the newsletter. Earlier in the year, we held a care summit where providers were part of that. So we had market stalls and we did that. We've had a couple of conferences with market stalls as well. And the training that I delivered, we opened it up to provider organisations as well. So a lot of them in the area did attend. But I'm always, trying to get out and about and talk to people. So providers are very much included in our comms.
Yeah, and I think the providers will probably be really useful in enabling people to feel confident about completing the assessment, because I do think there's probably still an accessibility issue where somebody perhaps hasn't got a relative or someone else to assist them, whereas actually their care provider or the companionship provider might be the only person that's able to help them and give confidence for people to use the digital form.
Absolutely.
But thank you for answering that. Thank you. Thanks, Sally.
Thanks, Diane. Nice to see you. Victoria Bayer, you have a question around challenge. Do you want to come in and ask that?
Thank you. Yes. Just interested from a provider and perspective for people that potentially have a learning disability or other impediments that I think other colleagues have talked about, whether it's language barriers or so on. What's the decision-making process then if an individual or the person that's supporting that individual feels that they should be subject to assessment or access to other support services?
Yeah, so that would be a conversation following, starting the process with the self-assessment. So and whoever is supporting with whatever, difficulty, we would have that conversation with them when we do the triage. So the self-assessment, I think, is important to remember. It's the start of somebody's journey. It's not, a start and finish at that point. They're starting that journey themselves with giving us as much information as they can or they want to, whether they do that themselves or with somebody, in whatever capacity. But that, it is the start of a conversation.
I think that's the important thing to remember, is we're not saying you must go through this way of doing it. That's the only way you can do it. Unlike my GP practice that does do that, which is very frustrating. This is just one route, and it's a facility and an option for people who want to use that. We're not saying you have to. It's not compulsory. You're not going to be blocked from just ringing up or getting somebody to say, I want somebody to come and visit me. So I think it's always keeping that in perspective. And of course, we never want to go down the route of you have to fill in an e-consult form before you can even get anywhere near your GP, which some GPs are. Don't quote me on any of this. I suppose I've just had it recorded, haven't I? But so we don't want to create
it's the
that
same with my GP. So yeah.
Great.
No, that's extremely helpful, and I think also making that really clear and accessible to people up front before they start the journey is important, so that communication goes out to individuals while they're filling it in themselves, because as you said, they may not have the requisite knowledge of their own diagnosis or support needs to be able to complete it appropriately in the first instance.
Yeah,
Thank you.
absolutely. And I think that goes, with whatever solution or technology or a piece of equipment that we might be offering. It is the start of a conversation. And, like we said earlier on, one size does not fit all, and it never will. So yeah, it's about having those different options. And this is just another way that people can start that journey or start that conversation, but not the only way.
Thanks, Renu. Susan, Susan Dutton, do you want to come in and ask your question about verification, which I think must is on a lot of people's minds?
Boss that wrote it, so I'll let him speak.
Oh, hello.
Richard.
Yes, Richard from Hertfordshire. So one of the things we do online portal at the moment. So we've got self-referrals for carers and self-assessments for social care. One of the things we're looking at is doing more online forms and sharing those forms with people. So sharing your assessment once you've got the outcome. We're raising barriers, though, at the moment about verifying who those people are. So we just wondered what approach you took in Kent, because at the moment we've had suggestions such as doing what we normally do, so we can only use it for existing people that we actually know and verify who they are because we've been out to visit them. But that minimises the whole idea of digital. So we just wondered if other people are taking the approach of you make the submission, then before we feed back to you, we'd want to know a copy of your driver license or passport. So we just wondered what you've done to verify who that person really is.
So yeah, it's a good question. So I'm not sure if I can answer it in full without speaking to colleagues back in KCC, but we do have the terms and conditions, we have the privacy notice, and obviously we've got the GDPR rules as well, and consent. So there's a lot that we do apply in terms of that verification, I guess. But yeah, it's a real good question. Yeah, I might take that back actually, and come back. But yeah, because I think we've got what everybody else will have in terms of T's and C's, privacy notices, GDPR, the audits that we do in terms of accessibility, etc. But yeah, thank you for that.
Thank you. Karen, do you want to come in? Karen Barnes, that is, in terms of question around customer satisfaction ratings.
Two questions really. One is about in Kent, have you noticed any difference in your customer satisfaction ratings since you implemented the change? Just are people as satisfied with having their needs kind of those conversations started in that way as they were previously? Do you know anything about?
I think in the slides there was 3 case studies where one of them was around how this sped up the process for her parents, because she was dealing with it on behalf of her parents. So she was able to go in, she works during the day, so she did it in the evening, and so she completed that at a time that suited her. And one of the things I think we quoted her, this lady said she felt the weight had been lifted off her shoulders because she was, it was accessible to her 24/7. She could complete it out of hours when, at a time that suited her. The response was quicker in terms of her submitting the self-assessment and getting a response, because our turnaround time in terms of, once we get that submission is within 5 days. So yeah, and that was during the pilot, but obviously we are looking at this now that we've rolled it out and we have gone live across the county. We will be tracking the customer feedback that we get, and we're hoping it's going to reduce complaints too. Yeah.
Nikki, you've put your hand up. Is this in relation to this question?
Yeah, it was just in part to do with the response that was given around the commitment to calling back in 5 days. We have needs checkers we call them online needs checkers at Hampshire. So they're intentionally not called assessments for the reasons that everyone's kind of been floating around, the terminology aspects and stuff like that. But they are essentially the beginning of. So what happens is people can, there's a part A which offers advice, you know, dependent on people's answers at each point of the domains. Well, no, initially, and then it goes into the Care Act domains for part 2. People can choose to submit to the local authority. We've got a really cool bit of integration, so it pulls through from there into our CRM system. So when they get the phone call, they don't have to repeat the information they've already given. Likewise, our contact centre agents can see what's already been submitted, so they know what to ask more questions on or what to draw out more from to determine whether they go on to be sort of placed into the workflow queue with the relevant team, depending on where they are. But the bit that I was going to check in with you is the bit that we find more and more tough as you know, sort of time pressures and commitments, is that commitment to call you back within 5 days, because we've still got huge volumes coming in through the front door call related. And we're also then, we've made a commitment for anybody that completes it digitally to make that call back to them. There's still that pressure on that manual resource. I think that's the bit for me. It's still sort of, we're still reliant on that. And you have to have, at some point, you have to have that element of conversation. And I suppose one of the things I was going to ask is whether you find that as well, but also whether there's something around, you know, more of an AI, more of a chatbot-y style. I don't know what level we can take this to, because we are still going to continue to see that high volume. And then there's a bit on from that sort of, you know, further down that assessment part about how much we enable people from a digital point of view to do support planning themselves, and how we get into that space as well. I think all of these, I think there's a bigger part, not just this initial front door bit. From our experience, the group that have found it the most helpful have been carers, because they've said, you know, your contact centre isn't open 24/7. My caring role is 24/7. Actually, at least this enables me to, you know, to actually, people say I'm entitled to a carers assessment. That's all everyone says to me, but I can't get through to you at the times when you're open. You're not open at the times when I could phone you, like 11 o'clock at night, when my caring responsibilities have finished. So that's the group that have really benefited from it. But again, when we can call them back is at times when it's not necessarily convenient to them. So again, it's that whole, so I suppose I'm sort of opening up a wider bit, but I just wanted to sort of just check in with you whether it was just something I was finding in Hampshire, or is actually a broader factor.
Yeah, I think you're right in terms of, you know, demand is on the increase with, you know, the impact of, you know, the legacy of COVID, you know, Brexit, cost of living crisis, etc. That there is a lot. And you know, in terms of our, you know, it's about having that initial contact with the person within 5 days. So, you know, and I think given the size of adult social care in Kent and the number of teams that we've got, it's about then getting those resources right at the front door. So that we are able to do that response within 5 days. But you're absolutely right in terms of, you know, the accessibility around that 24/7, and people can access it and submit it at a time that suits themselves. So that the things that we're now looking at is around the online financial assessment, the online carers assessment, and also very, very soon we are going to introduce the virtual chatbot facility on our front-facing platform, which is Kent Connect to Support. And by doing that, and again, we're going to pilot that first initially for maybe 3 to 6 months to see, you know, if that is a useful tool in adult social care to have, which if it is successful, it's going to reduce possibly the number of people that might complete the self-assessment, and also reduce the demand that comes in through our contact centre colleagues as well. So that there's lots more to be done, I think, going forward, definitely. But again, you know, it is promoting that channel shift, isn't it, and future proofing for future generations, but not taking away anything that we do traditionally and always have done. But yeah, you know, and I think in terms of our expectations, and how we, you know, we work in KCC, it was the decision that the Task and Finish group made around having that 5-day turnaround. So, you know, that person does get contact, and we tell them that when they submit the form to us, that, you know, they will be contacted within 5 working days. So we do make that clear as well.
Thanks, Renu. I think we've only got a couple of minutes left, but I think we'll just squeeze one last question in, and that's from you, Cecilia, if you want to come in, and that's around harder to reach groups and getting engagement.
Hi, thank you. I'm Cecilia. I work for London Borough of Redbridge. I'm one of the team managers in the integrated adults teams. And what I was interested to find out is from the cohort you had, I mean, did you have any assessments from like our hard to reach groups? I'm talking about, like sometimes people, the drug and alcohol service, sometimes some of the mental health services,
Yeah, I don't know the answer to that, if any of the submissions we received were from hard to reach people. But what we do, in terms of our community participation and our community roadshows and digital roadshows, we are, reaching out to other groups, through attending faith group meetings. So we do include them, absolutely we do. But in terms of actually having any submissions, I haven't got that data, but I can find out and possibly come back with a number.
Thanks. So just from me to say thank you to everybody who's presented and everybody who's joined before I pass over to Lyn to see whether she has any final closing remarks.
No, just to say thanks everybody for coming. It's a kind of evolving landscape, this, and we've got a lot to learn and a lot to think about, and more development and research is always needed in everything. But I think the biggest thing is we all know that demand is increasing. I don't think it's going to give you cashable savings, is that you can stop the kind of a level of resource you need, but it may help us manage what will be a demand for increasing resources over time by utilizing kind of modern and flexible ways to engage with many people, but it won't be all people. And as Cecilia made a very good point, that's where we want to deploy our professional expertise, where we can reach out and work directly with people who do have drug and alcohol misuse problems, who are at risk of harm or need safeguarding responses, and people with more complex needs. So it's one way of trying to get that balance. It won't be the answer to everything, but I think we can all learn a lot from you, and have heard a lot today. So fantastic, the work that you're all doing. And I think we'll be on to you to give us more examples of how you're taking things forward. So great, fascinating. And AI, well, that's a whole other debate, isn't it? So that'll be very exciting as well.
Yeah.
So thanks very much for joining. Thank you.
Thank you. As we said at the beginning, any questions that are in the chat that we've not answered, we will get a written response out to attendees. But thank you, everybody. And thank you, Renu and Kent, for sharing all of your work.